So now we are going to study about the testing, that after the assessment and approach we have to do the testing of the patient. So how do we do? Before that, I just want to talk one thing about that. That is, whenever you do the testing, you have to make the records of it. For example, you are testing the range of motion of the joint of the patient, or you are testing the, in the assessment, you are taking the MMT. Means any of the testing which you have taken of the patient, you have to note it down and keep it as a record, because it helps you in the progression also, and you can see that if the patient is improving, or the patient is remaining the same, by the values of these records, right? So you have to maintain a record of it, right? And it also helps if somebody is or some other doctor is referring, so it will help him that what was the condition of the patient and what is now the condition of the patient by checking on that values. Okay, so to do that we have to do some testing, and now we are going to discuss few of these tests which we are doing on the patients, right? So let's discuss it one by one. When we are talking about the functional test, right? What are the functional tests? In this we are checking the patient's ADLs, means the patient starting from his functional activities to his personal care and household and work creation. For example, if personal care is involving, or the functional activities are involving, like mobility in bed or chair, means a, or transfer, during the transfer activities when the patient is not able to, for example, he is paraplegic, then the transfer activities, like what is the mobility of the patient, right? You have to assess that. And the personal care, like patient is the patient able to eat, dress himself or herself, and is he able to wash, means he able to take his bath himself or herself. Then if we talk about the household activities, like cooking, washing, lifting, and anything, doing work in the kitchen, and sweeping the floor. And if we talk about the work creation, means whatever job he or she performs, is he able to do, right? After assessing these activities, and one more point, that you have to assess these activities in the patient's natural environment. Means for example, if the patient, you have to assess the patient's household activities, then it should be, the environment should be such that the patient was working, and also in his job, that what was his job, you have to assess accordingly, right? And then according to that, the physiotherapist or his doctor making the or planning the treatment accordingly. So the what are the priorities of the patient which we have to focus on, and what are the other things that we can delay, right? Means we have to first treat the priority things, and then we have to follow another things, right? These comes under your functional test. Okay, and now if you talk about the test of the joint range, that is your joint range of motion, right? In this, what we are doing, we are assessing the joint range of motion. For every joint we know the what are the normal values of the joint range of motion, and then we are going to assess the patient's involving limb, right? That what are the joint. But before that, you have to be sure that you check the patient's non-involved limb, means which limb is not involved. You have to first check the joint range of motion of that joint, means contralateral joint. Then you have to assess the range of joint of motion of the involved limb, okay, or the ipsilateral limb, right? And you know how to measure it. You have to take your goniometers, right? With the help of goniometers, we have three goniometers, that is half arc and full arc. And half arc, we have two goniometers. If one is small for the IP joints, and another one is for your elbow joint and wrist joint, right? What you have to do, you have to place the point pivot. We have the, for example, this is your goniometer, full log goniometer, right? So what you have to do, uh, this is a pivot for the goniometer, right? And you have to place this pivot on the fulcrum. Means, for example, you have to assess the shoulder joint range of motion. Then for the shoulder flexors, you have to place this fulcrum on the greater tuberosity, right? And then you have to, after placing this pivot on the joint, means on the fulcrum, then one arm, that is your proximal arm, you have to place parallel to the thorax, and then the another arm with the moving limb, right? Then you have to assess the joint of range of motion. And for every joint, as I told you, you have the certain values, that the normal values, and you have to compare it with the contralateral limb, right? So this is a test of joint range of motion. It is very important, right? If it is clear, then we proceed to the next test. Yeah. Yes. Now the next test is test for neuromuscular efficiency. Means here you have to test the nerves as well as muscles, right? Neuromuscular efficiency. In this we have the electrical test, your MMT, your circumference of measurement, and you have your static power test. Before discussing that, I just want to share one more point in the test joint range of motion. Either you measure your joint range of motion with the goniometers, right? Wherever the goniometer is not possible, for example, if you are measuring the joint range of motion of the thorax, then you can use the inch tape there, right? Or your measuring tape. There you put it, and then you check the joint range of motion, right? Then if you proceed to the next thing, we have to test the neuromuscular efficiency. Here we have the electrical test, your MMT test, your circumference of measurement, and your static power test. Here what we have to do, let me take a slide to make you understand this. Okay. See, here if we see the electrical test, right? First is the electrical test. What we are doing in the electrical test, we are checking the your muscles only and the nerves by the electric test, right? And what is this electric test? If I say this is your EMG, electromyography, right? You are checking the electromyography, that you place the electrodes, and then when you do the activity, there is formation of some graph, right? That graph will show you that what is the activity of the muscle, right? So this is your EMG, or you can check it by your SD curves, that is your strength duration curve. With this you assess the nerve, that how much the nerve is working. How you do this, you take the, you use the muscle stimulator, and then you place the electrodes, and then you check the muscle contraction at various intensities, and then you draw the graph, right? And in SD curve, your strength duration curve, means in the strength and duration you plot a graph, and you get some values. According to that, there you check the according to the values, there you diagnose that in which the or in which position the nerve is. Means, is it in the neuropraxia or neurotomesis or axonotomesis, right? Means the nerve lesion is how much and how it is progressing, right? I'll make detailed videos on SD curve also, but here you just remind that in the electrical test we talk about the EMG or SD curve, right? And in MMT is manual muscle testing. So what you do in a manual muscle testing, manual means you do something manually, means not by the machines, right? And muscle testing is checking the muscle. So you are checking the muscle manually, that is your manual muscle testing. If I did discussed in detail, that is your MMT, right? It is given by your Daniels, right? Means Daniels just that given the MMT, and he gave some points that how you check it. We have some grades in this 0 to 5, right? We have this gradings according to the Oxford technique, and we apply it on the different muscles, and we check the that in which grade the muscle is. If we talk about the 0 to 1, 0, 1, 2, 3, 4 and 5 grades, what are they representing, right? I'll tell you that 0 means no movement, means the muscle is not having any grade, right? Means the muscle is not responding to you, right? So you gave the muscle grading 0, right? And if you test the muscle and it is of grade 1, then it means that there is a flicker of contraction, means you just feel the contraction but there is not much movement, right? Then you gave the muscle grading 1. And if you talk about the grade 2, then what we have here, we have the movement or partial range of motion. See, if the full range of motion is there, full range of movement is there, let me write it clearly. Either the full range of motion in gravity eliminated plane, or there is a partial range of motion, okay? Partial range of motion against gravity, right? I'll give you one example to make you understand this, but for now you just learn these points. And if we talk about the grade 3, here we have the full range of motion against gravity, right? And in the grade 4, if we talk about, there is again full range of motion with minimal resistance, right? And if we talk about the grade 5, that is your full range of motion with maximum resistance, right? So these are the grades, and if I name them or grade them, 0 means no movement, 1 means flicker of contraction, 2 means your muscle is weak, 3 means your muscle is fair, 4 means your muscle is good, and 5 means your muscle is normal, right? So I'll give you one example of this to make you understand the MMT and how you grade the muscle. Let's take the example of elbow flexion, means you are testing the biceps, right? How would you test it? What is the function of the biceps? The function or action of the biceps is flexion of elbow, right? So if we check this, always check if there is a movement with the grade 3, means if you ask the patient to flex his elbow like this, right? If the patient is able to flex, right, then you proceed to the grade 4. If the patient is unable to do that, then you can go to the grade 2. For example, if the patient is able to do, then you proceed to the grade 4, and then you provide the resistance on the distal joint, right? You provide the resistance and you provide the minimal resistance, and this resistance varies according to the patient, means if the patient is very lean or very thin or weak, right, and you have to give the resistance which is according to the patient, right, patient's minimal resistance. And compared to that, you have one patient who is very bulky and is or the, you can say, strength trainer, right, so he must be having the more muscle bulk, and you have to, here you have to provide the more resistance, means the resistance is varies according to the patient A and patient B, right. And if we are proceeding to the grade 4, you provide the minimal resistance and patient is able to perform the full range of motion, then you provide the grade 4, right. In the grade 5, either you provide the maximal resistance and then you ask the patient to do the complete range of motion, and if he able to do, you provide him grade 5. But there is also one more test, it is called the break test. You ask the patient to perform the full range of motion and then you try to break that movement, means you provide the resistance in the opposite direction, you try to open the arm or extend the elbow, right. But if the patient and ask the patient that he or she will not let you do that, right. If the patient is able to maintain his arm in the elbow flexion, then you provide him grade 5. But if you are able to break that movement, means patient is not able to maintain that movement of elbow flexion and the therapist or his doctor break the movement, then you provide him grade 4, right. 3, 4, 5 is clear as so far. And if the patient is having and you ask the patient to bend his elbow or to flex his elbow and the patient is unable to do, right, then you go to the grade 2, right. Here what you have to do, either the patient is completing the partial range of motion, means this is a gravity eliminated plane and the patient is unable to do it, right, then you provide the gravity eliminated plane to the patient, means for example you provide the suspension board at the elbow, like for example you can also place your hand, right, and then you can ask the patient to flex his elbow. Now there is no gravity, patient is able to complete his full range of motion, then you provide them grade 2. But if the gravity eliminated plane is also there and the patient is unable to move or unable to complete the movement, then you just palpate at the tendon that and ask the patient to flex his elbow, right. If he is trying to do that and is unable to do the movement, but you feel at the tendon that there is a movement, you can palpate at the tendon and your tendon shows the contraction, then you provide the patient grade 1, that is flicker of contraction, right. But if there is not any, that flicker of contraction is also not there, then you provide the muscle grade 0, right. So this is your MMT, clear. You provide the grade 0, 1, 2, 3, 4, 5 according to the muscle, and for every muscle you have to assess accordingly, right. So if the MMT is clear, then we can move to the next point, that is your circumference of measurement. In this what you have to do, this you have to assess the muscle bulk, right. Means if the muscle is you strengthening the muscle, and if you want to check the muscle is hypertrophied or atrophied, then you assess it with the circumference of measurement, right. Means you are checking the circumference of the muscle, but with what instrument you are checking it, you can check it with the measuring tape, right. You can check it with the measuring tape. You are given some points, right. There you can put the inch tape or the measuring tape, and then you can record the inches, means you are giving the normal values also. Accordingly you can compare it with the contralateral rim, then you will get to know that is the muscle is normal or not, means is the muscle is atrophied or hypertrophied or what is there, means you can compare it with the normal limb, right. So this is the circumference of the measurement. And in the static power test, if we talk about what is there, static means same, right, means at the rest. So here you what you have to check is Isometric test means you provide something and you ask the patient to do that. There you test the power of the patient, that how much is the power. For example, you can give the patient gripper, right, that is having the springs, that is providing the resistance, and the patient is not able to move that, but the springs are providing the resistance, right. So you can test the power of the muscle, means how much the patient is able to do that. So now the machines are available where the along with the spring in the gripper there is a meter also where the patient's movement is recorded, right. From there you can check that the patient is doing or the how much the muscle is responding. Okay, so that is your static power test. If you proceed to the next thing, then is your dynamic power test. Okay, so we have discussed the static power test. There we are testing the muscle power at the rest, right, means muscle is contracting but the it is not showing any change in the length of the muscle. But in the dynamic power test we are checking the muscle power in the dynamic position, means the muscle is moving, right. So a muscle is showing the length of the change, right, length of the change in the muscle. So in the dynamic power test, this is devised by your Delorme and Watkins, right. What and it is used or as a basis of the PRE. We will study that what is PRE. This is your progressive resistant exercises. Right? PR is your progressive resistant exercises. Means Delorme and Watkins state something. I'll tell you what. That forms the basis of your PRE. So if we talk about, I'll do here Delorme and Watkins, right, dynamic power test. So Delorme and Watkins proposed that, and they proposed 1 RM and 10 RM, right, and these form the basis of your PRE, right. So PRE is your progressive resisted exercises. So what is 1 RM? If I talk about what is 1 RM, 1 RM states for the 1 repetition maximum. RM is your repetition maximum. So we check the muscle dynamically, that what is the power of the muscle. I'll tell you how. See, repetition maximum you got that is your RM. This is devised by your Delorme and Watkins. So what is 1 RM? 1 RM is amount of the weight lifted once with complete range of motion without any fatigue, right, with complete range of motion and is lifted once. Clear? That is your 1 RM, means 1 repetition maximum. This is your amount of weight. It's very important. Amount of weight lifted and completes its range of motion, means whatever the muscle, right, completes its range of motion without any fatigue. So the person who lifts the amount of weight once, right, and completes its range of motion without any fatigue, that is the patient's or person's 1 RM, means we test that the how much power is in the muscle. So the 1 rm of the muscle, if the patient is lifting 3 kgs of weight, and you ask the patient to do the elbow flexion, right? And with the 3 kgs of weight, if the patient is able to perform the complete range of motion without any fatigue, right, that is his 1 rm, right? And if I talk about the 10 rm, 10 rm is what? If the patient is lifting, or if the someone is lifting the weight 10 times, completes range of motion without any fatigue. So for example, if there is a one person, right, and he has given 3 kgs of weight, and he lifted it once, right, he lifted it once without any fatigue and completes its range of motion, right, then the person's 1 rm is 3 kgs, right? And if the same person is given the 2 kgs and he lifted it 10 times, and if he lifted it 10 times without any fatigue and it completes its range of motion, then this person's 10 rm is 2 kgs. Simple. Understand? Means the amount of weight that is lifted and completes range of motion without any fatigue, that is his rm. And the number of times he lifts, that is 1 rm, 2 rm, 3 rm, 10 rm, right? That is his rm, right? So if the patient lifted the weight once without any fatigue and completes his range of motion, then it is 1 rm, any weight you gave him, right? And if he completes his 10 rounds with complete range of motion and without any fatigue, that is his 10 rm, right? So it is a dynamic test because the muscle is changing its length, right? So this is a dynamic power test, means we are testing the muscle dynamically, right? So it is devised by the DeLorme and Watkins, which form the basis of your PRA, right? Understand? So this comes under your dynamic power test. Clear? Let's proceed to the next test, that is your endurance test. So what do you understand by endurance test? It is very easy. If we say endurance means your ability to repeat the task, right? So endurance test is given, or in the endurance test certain activity is given, and we have given the certain time, right? For example, we take the example of marathon, right? We have some time, a fixed time, in which person has to complete the fixed distance, right? So the person is doing it repeatedly, na, means he is not just take the one round of it. Marathon is a very long distance, so you are performing the activity repeatedly in a fixed amount of time, that is your endurance, means that checks your endurance. So in endurance test, what happens is, in the endurance test you give some activity, the activity should be repeated task, in a time, right? So that checks your endurance. I'll give you one example. For example, there is one person, let's take here example, there is one person A and there is one person B, right? And if the one person, that is A, is given 10 kgs of weight, right? He is given 10 kgs of weight, and B is given 2 kgs of weight, right? For example, the person A is given 20 kgs of weight, let's say, right? And the person A lifts this weight once very nicely, means he lifts this 20 kgs of weight once, but he cannot lift it second time, means he uses its maximum strength to lift his weight once, and he did that, right? So that 20 kgs of weight. But if I ask the person B to lift this weight of 20 kgs, he is unable to do, or he is unable to lift it at least once, right? But the person A has lifted it once very nicely, and but he is unable to do or unable to lift it twicely, right? So this is the strength of the patient, right? But the person's B strength is not that good. But if I given the person B 2 kgs of weight, right? If I given the person B 2 kgs of weight, he lifted it 100 times, right? But this person is unable to lift this 20 kgs of weight second times. So according to you, tell me that person A or person B, who has the best endurance? Comment me in the comment section. Pause your video, think about it, and just tell me the answer. Okay? Okay, now we will discuss the answer. See, the person B, although he lifted the weight 2 kgs and he lifted it 100 times, right? But the person A, although he has lifted the 20 kgs of weight, but he can't lift it the second time. So the endurance of person B is higher than the person A, right? So endurance of person B is higher than the person A, because he is doing the activity repeatedly, right? Doing the activity repeatedly. But if we see in the case of the person A, he lifted maximum amount of weight but once, right? So it is his strength, not the endurance. If you have to check the endurance of the patient or the person, you have to give him the task that in which he have to involve in doing the activity repeatedly, right? So that test his endurance. Clear? So that is your endurance test. And now if I talk about the speed test, that what is the speed test? See here, in the speed test you give some task, right? You give some task and you calculate the time. So you give the person some time and you ask the patient that in that time frame he or she has to complete, right? So in that time of frame he or she has to complete the activity, and the speed, the if he has completed that activity in the time or in prior to that, that is his speed, right? That is the speed test. In this I can take the example. For example, you gave a task to the patient of dressing, right? Or to walk some distance, right? Let's say 1 meter, and you gave the time, or you calculate the time that in how many time or how much time the patient is dress himself or walk the distance of 1 meter. So it is his speed with which he performs the activity. That is the your speed test, right? Now after this we will discuss another test. These are your tests for coordination, test for sensation, measurement of vital capacity and range of respiratory excursion, measurement of your leg length, and measurement of angle of pelvic inclination. Let's discuss it one by one. These are the tests which are remaining. If we talk about the test for coordination, right? Let's discuss about the test of coordination. So coordination test. So what are you checking in the coordination? So you have to see the patient, his purposeful movements, right? Whether his gait is coordinated, means he walks nicely, or his gait is clumsy, means he is not coordinated, right? You have to check his gait, his purposeful movements. For example, is he able to bring his glass of water and drink it properly, or is it his not able to, right? So these comes under your coordination test. So to check it, we have some things, or we have the few examples by which you can check it. In the coordination test, what you check, you can ask the patient to touch his index finger like this, and then place it in his nose, right, like this. So to touch his index finger and then bring it with the another hand to his nose, right? This is a one test. Or you can ask him to take his both the hands, abduct his hand, and to place these fingers or your index fingers both to touch it with each other, right? Or you can ask him to walk in a straight line, or you check the coordination by lying the patient and bringing the foot of the patient or do the along the shin, right? So these are small coordination tests with which you can check the coordination of the patient, right? Let me note down here few. Walk in a straight line, finger to nose test, finger to finger test, right? And moving heel on the shin. So these are some coordination tests by which you can check the coordination of the patient, right? And if you talk about the test for sensation, in this what you can do, you are checking the sensation, means you are checking for the let's write here, sensation test means you are checking the sensation of the patient's temperature sensation, okay, the patient's touch sensation, pressure sensation. These all are the sensations, right? So how you check it? You know various kind of dermatomes in your body. If you don't know, please check it, the dermatomes, various dermatomes, and you ask the patient to close his eyes, right? You ask the patient to close his eyes, and after closing his eyes, you check the dermatome by putting some, if you want to check the temperature, then you place in the test tube you have to place the hot water, and in another test tube you have to place the cold water. So by that you just put it in specific dermatome and ask the patient with his closed eyes to tell you that what is he feeling, right? If he feels hot, if you place uh, the hot test tube in the particular dermatome, then his sensation is fine. But if he is unable to detect, then you can check the sensation, right? Means by doing this method you can check his sensation, that at which dermatome his sensation is impaired, right? Same is with the touch and pressure. You just put the or place the cotton swab, and you just put it in the different dermatomes, and you can check that at which dermatome the patient sensation is impaired, right? So these sensations are checked with the closed eyes of the patient, otherwise the patient can see, right? So that is why the closed eyes, with the closed eyes it is checked. And you also have to compare it with the contralateral limb, means which is fine limb, which is not involved. You also have to check it in there, that is it the same thing the patient is not getting, or if it is understanding you, then is it normal in the contralateral limb, and it is also it is only in the impaired limb in which the patient sensation are impaired, right? So you have to check all the sensations in particular dermatomes where you find that maybe in that dermatome the patient's sensations are impaired, right? There you have to check it, right? So if you move to the next sensation, we have the measurement of vital capacity and range of respiratory excursion. Here you have to check the patient's vital capacity and how much patient is able to breathe, right? So this you can check with the spirometer. Spirometer is the instrument through which you can check the patient's vital capacity and excursion. So what is a spirometer? It is the instrument, right? You have like this instrument, and there are the three tubes in which the balls are there, right? Different colors, red, yellow and green, right? So, and one mouthpiece is also given along with it. This is your mouthpiece. With it you have to do the inhalation, right? And these balls are taken up. If you just inhale, these balls are getting up, right, accordingly that how much you inhale, right? So by this, or how much you exhale also, then also these balls are getting in the upper side, right? So if all the balls are up at the top, then your breathing level or your excursion is good, right? And if it is if the patient is unable to hold the balls at the peak level, or if he is unable to blow the balls right through the mouthpiece, if he is unable to inhale or exhale properly, then these balls won't come up. So this is your instrument by which you can check the vital capacity and range of the respiratory excursion, right? And if we talk about the next test, there is your measurement of leg length. So if we discuss it in detail, so measurement of leg length. So what is the importance of this? Means you have to check it whether, if you have doubt that the patient's length of the leg is not accurate according to on the both sides, right? So then you do the leg length test. In this, what you have the two types, right? Either you check the true leg length, or you check the apparent leg length, right? In true leg length, what you are measuring, for example, this is a patient, right? And the therapist is assessing the leg length, and the instrument by which you have to measure it is your measuring tape again, right? What you have to do is, there is your ASIS, that is your anterior superior iliac spine, right? That is your anterior part of your pelvic bone, right? This is your anterior superior iliac spine. So in from the anterior superior iliac spine, you measure with the tape measure to the lateral malleoli, right? If you measure with the tape measure from the ASIS to the lateral malleoli, that is and note down the distance, that is your true leg length, right? Either you measure from the ASIS to lateral malleoli, or you measure from the GT, that is your greater trochanter, that is on the hip, right, your raised part. from the greater trochanter to the lateral malleoli, that is also your true length, right? So your true length, in your true length, what from where you have to measure? Either from your ASIS to the lateral malleoli, or from your greater trochanter to your lateral malleoli, right? But in the apparent leg length, if we talk about the apparent leg length, then we measure it differently. Let's see how. If you talk about the apparent leg length, then how you measure? You measure it from either from the Xiphis sternum, Xiphis sterni to umbilicus, right? And then from umbilicus to your medial joint line of the knee. And from medial joint line of the knee to your medial malleoli. Right? If you measure and follow this procedure, that is your apparent leg length. Right? So this is your true leg length and your apparent leg length, and you have to measure it on the contralateral side also. Then only you are able to know or find the difference between both the leg length. Okay, and you can compute that is there any difference or not, right? So this is the method to check the limb length. And the last test, if we talk about, is our pelvic inclination test, right? Measurement of angle of pelvic inclination. If you measure the pelvic inclination, means how much the pelvis is inclined. Is it inclined anteriorly or is it inclined posteriorly? It is very important to know, because due to this the back pain issues came, right? So this is again checked it by the pelvic inclinometer, right? This pelvic inclination is checked by your pelvic inclinometer, right? You place it there and you came to know that how much the pelvis is inclined. Is it inclined anteriorly or is it inclined posteriorly, right? So after assessing the patient, means first the therapist came and approached to the patient, and then he assessed the patient, and then he goes for these tests, or if it is available in the record part, then he go through this. And after going through this and also after seeing the patient's response, he can plan the treatment of the patient accordingly, right? Means according to the assessment. After the assessment and the test which he has noted, right, or seen, plus the response of the patient, right? So with his knowledge according to of the physiotherapy, he can plan the treatment of the patient after doing this, right? Plan the treatment of the patient. Means it includes various exercises like according to the patient, whether the isometrics are to be done or the isotonics are to be done, or the patient should be put on the resisted exercises, or the patient should be given the mobilization, and various ample of techniques are there in the physiotherapy. Means the according to the patient assessment and response to the patient, the physiotherapist has to plan the treatment accordingly, so that the patient's recovery should be very fast, right, or it should be there. So to plan the recovery of the patient, the physiotherapist plan the treatment accordingly, so that patient get respond betterly, right, and recovery of the patient should be there. So this is the purpose do teach, or this is a purpose to learn the introduction to exercise therapy. Means what is the purpose of exercise therapy? Means first you have to meet the patient, understand his problems, know his history, and then with the history you just assess the patient, right, and do various tests on the patient in the assessment part only. Then you plan the diagnosis. After the diagnosis you plan the treatment accordingly, right, according to the assessment of the patient. Means where the patient is lacking, or where what are the abilities of the patient that you can strengthen, or what the patient is not able to do, that you have to, or you can make the patient in. Means with the best possibilities plan the treatment accordingly, so that patient should be respond in a better way and get his recovery, right. So this is the whole motive of the exercise therapy. Thank you so much. Please see my video. If you don't understand some points, just let me know in the comment section. I'll try to solve that, right. And please watch my video and share and subscribe, like the hit button. Thank you so much.